Hi. Hey, I can't seem to hear anything though. Um,
Now, can you guys hear me okay now?
yeah,
Yes.
Okay, perfect.
yeah.
I see what I did. 1 second. Let me switch this over. All right. I think I got it. Let me see here. All right. Can everybody hear me now?
Yes.
Okay, awesome. Perfect. So, happy Friday, everybody. I am here to answer whatever questions you have about the course. So, this is kind of just an open forum for whatever questions about the course you guys have. I'm happy to answer them. So feel free to start asking. Jess, I'm going to make you the host so that you can let people in case I'm distracted.
Okay, sounds good.
All right. There you go. Awesome. So what do you guys have? What do you want to know?
Oh, hi, Dr. Pope. My name is Michelle Rippey. I was a client of yours about
Michelle?
3 years. I don't know if you remember me with Gunther.
Yeah, how are you?
Okay. Um, I joined, but I didn't know if is this for just dogs or cats as well?
So there's a lot more data available in humans and then dogs, and then there's very little in cats. However, the things that I'll be suggesting are applicable for cats. The tests we'll be talking about running can be done in cats. The dietary recommendations will be appropriate for cats with obviously their species difference suggestions that we make. But yes, it's absolutely applicable for cats. When I have the cat data to show, I put it in the lecture. So yes, both dogs and cats.
Okay, thank you.
Yeah, awesome. Thank you for joining. I'm excited to see you again.
Yes.
Awesome. How's everybody else doing? What other questions you want to know about the course? And Michelle, we'll be sending out an email. And next week is like the intro week where you'll check out like the membership site and how to use it and all those kinds of things. So that'll be all next week.
Okay.
Can I ask a question about yeah, how do I know when it starts Monday? Okay, great. So on Monday, and you guys will get an email just to make sure that you know where to go and all of that. Next week is going to be the intro week to make sure that everybody understands how to use the membership site, because there's a closed membership site to access all of the course materials where you're going to be submitting your questions, the links for the live calls. So next week is all about like getting comfortable with the membership site, making sure that you know how to use it, asking questions, and then accessing the content. And then June 10th is the first like official week of classes. So Michelle, you guys will all be getting an email to make sure that you've accessed all of that, that Jess has received all of your signed documents, because we need the agreement signed before people can access everything. And so basically what'll happen is it's like an automatic access that's granted. So it probably happens at midnight, I'd imagine, on Monday. But every Monday you'll have a new module that you're allowed to access to get the information. So you'll get an email this weekend making sure you know where to go on Monday, and then every Monday you'll have new content available to view. Then someone asked if they could ask a question about a vitamin D elevation. if it's related to the course, I can't answer any medical questions about animals.
Right, Dr.
Yeah,
Paul.
Jane, do you have
So,
something? Go ahead.
hi, yes. So, I mean, in relation to what you mentioned, so if I mean, if I have a cat now who's I actually have a cat now who has suspected lymphoma. So
Okay.
I'm just curious as to whether I mean, apart from the course, you can offer one-on-one consults for real life cases. Um,
Mm-hmm.
yeah,
So,
just curious.
where are you, Jane, in the country?
Singapore, Singapore.
Oh, you're not even in the country. That's
No.
amazing. So,
Yeah,
so
so
nice
I was
to see you
always
far,
because I
far
understand
away.
that I understand that you don't really take kind of online consults.
Yeah.
I was curious as
Yeah.
to
Because it can
yeah.
be hard to it can be hard for us to institute treatment plans without the help of a veterinarian. So we've had a lot of challenges doing that. So oh my gosh, so what time is it? It's like midnight there, right? 1 a.m.
It's fine. I'm used to it. Midnight, yeah.
Midnight, yeah. Well, hi from the, I guess you're in the future, we're in the past. So how can we help someone one-on-one? And let me see how this might be relevant to the course or any future courses. So do you have a veterinarian who is open-minded to any of these kinds of modalities?
Meaning that he or she would be willing to get on a call with you to
Or even
consult
would
or
be willing to like institute protocols if we said, like we suggest using this type of product. This is where you could, this is a place that you could consider getting it from. This is how we use it. Do you have anybody like that local?
yes, I would.
Okay. So, because I'm trying to think of what it will be most helpful for you. And so your kitty cat is suspected to have lymphoma?
Yeah, so that's the thing because I've never done a biopsy because
Okay.
if to do that I would need to go into the intestine
Yes.
area to
Mm-hmm.
do that.
Mm-hmm.
So now it's just guesswork and based on currently he's on low dose vincristine
Okay.
based on suspected lymphoma and it's responding. So therefore the vet is saying, okay, it's very likely to be lymphoma because it is responding to that treatment.
Yeah.
But it's going to be lifelong. I want to find a better way that
Yeah.
has
Yeah.
got because I'm told there's no cure.
Yeah.
It's I just have to send him in like weekly and probably later monthly. I'm not comfortable with that as much as I mean I try not to I'm trying to look for alternative ways
Yeah.
basically. Yeah.
Okay. I'm trying to think of anybody that I know who is closer to you that could be more of a support. The the thing about cancer, and this goes to cancer prevention too, and part of the course, since this is obviously what the Q&A is about, is that it's always an individualized treatment. So that's why I'm trying to think about how I can be helpful for you in this situation or who I can guide you to, because whatever is driving your kitty cat's lymphoma is going to be specific to your pet. And without doing like a thorough medical record evaluation, it can be hard to make general suggestions on what to do. Also because you can't access all of the same diagnostics that we can get here. And then the supplements is harder to in Asia to get them because you guys use different ones than we have. I think what I'm going to do is I want to send you 2 websites and I want you to tell me if there's anybody in your area. You can do that now. I'll put them in the chat. And if there is, we might be able to do like a doctor consult with them. So let me just pull up these 2 website links and then I will, let's see. Let me do this one. And then I'm going to do another one. I do know, let's see, this is one, and then let me put the other one. Because that might be the most helpful way. Okay, let's see. This one, and then I'm going to give you a third one. this third one. Okay. So while I'm answering these other questions, Jane, if you could take a peek and see if there's anybody close to you, because maybe what we can do is see if they can get involved with us and we can help you that way. So take a peek
Okay.
at those websites for the
Thank you. Thank you.
yeah,
Okay.
people, and then we can see what we are working with.
Okay.
All right. Let's see. Let me go back to these questions. All right. Can I take the course at my own speed? So the way the course content will work is that each week there will be a new module made available for you to review at your own pace when you want to, on demand at any time. The lectures are about 10 to 15 minutes a piece, and each module has somewhere between like 4 to 8 lectures. You will not be able to go past the content that has been made available to you. Like, you won't be able to rush ahead to the end. There will only be weekly content made available each week. But if you get behind, you will always have access to what was available to you. So let's say you go on vacation, or you have a really busy week at work, or there's a deadline due and you can't get to the material that week. Anything that you missed will still be there waiting for you, but you won't be able to jump ahead to the end. And I'll explain in the intro why I kind of want to do it in a stepwise fashion, so it all builds on each other. But you can watch it at any time. If you're an early bird, if you're a night owl, however you want to do it, you can watch it at any time. So yes, definitely. Hi, Mark. So nice to see you. Oh, it's Amanda. Yeah, Canada, then I'm in South Carolina. In terms of diet, yeah. Yep. Yes, I actually responded to your message on Facebook just about an hour ago. Having Laura and Paul's as a resource is like A plus 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 plus. Like, they're the best people that I think you could have available to you, because she's does her diets from an integrative approach, and then Paul's is obviously super customized. So I'm not going to have you change any of that, but what I'll do is I'll make some suggestions about like how to tweak and focus your current diet strategies for specifically cancer prevention, if that's what we determine is the best for your pet. Also when to feed, because that's something that's not really discussed. You know, most nutritionists just tell you to feed as you normally feed, which for most people it's twice a day. So we'll also talk about like when to feed in a cancer prevention strategy. Also, are you able to recommend practitioners in our area who are familiar with your protocols or have worked with you before? I have some holistic people in South Carolina, but they don't seem to have a lot of knowledge on the things you work with in our primary acupuncture. Yeah, so the search engines I actually just put in the chat for Jane are some of the best ones. So you can use those at any time. But also there are veterinarians that are currently going through my training program. So there will be, as of this summer, 8 new veterinarians, and then each year that will get added to as people go through my program. The closest to you in South Carolina are going to be in Virginia. There's 2 people in Virginia in this last round. So yes, I'll be able to give you the people that have been certified in my program, and then also the general search engines for more holistic veterinarians. Okay. How many weeks does the course take, and will materials always be available so I can take it during my free time? Also, my dog is currently being treated by Prism, yay, and undergoing chemo as well. I have 2 other dogs that I hope I can help and would really like to join your course. Do you have longer payment plans? Thank you very much. So how many weeks does the course take? So the course it'll start on Monday. That'll just be the intro week. And then there's 8 weeks of training. So it's going to take us through the end of July. You will have access to this material indefinitely for all of time. The reason to stay on track with the course is so that when we do our 2 live calls that are included with the program, you have access to me and you can ask questions, but you can watch the material whenever you want, forever. So let's say that you go through all of it, but maybe you forget about it and you want to access it 3 months, 6 months, 12 months later. You can go back at any time and always have the material. So it's going to be yours forever once you take the course. It's just staying on track, one, so that you can finish it, and two, so that we can support you and answer your questions during it that would be recommended. So it's going to go through the end of July. And then the 2 live calls are going to be in the middle of, let's see, in the middle of July, in the middle of August. We're going to do our 2 live calls. Let me scroll back up and ask the other questions. Yes. And since you have 2 other dogs, you don't have to buy a course for each one of them. The course can be used for however many pets you have. The scorecard that you're going to get to analyze each one of them can just be used for each one of your pet. So the course is all encompassing for all of the fur babies in your household. You can do their own scorecard for each one of them. And do you have longer payment plans? As of right now, we just have the 3-month payment plan. It is something that someone else had asked about. So what I would say, Steph, is just keep an eye on our social over the weekend in case we do any last minute changes to that. I can't answer that directly for you right now, but what I can tell you is that if that does change, you will know by this weekend. Do you ever use keto diets? Have you ever used or had success with poly MVA? So I will answer those questions in addressing the content of the course, since that's what we're here to talk about. So ketogenic diets, low carb diets, recommendations on protein, fat, and carb concentrations will be addressed in the course. We'll talk about what the recommendation is from a cancer prevention, longevity, disease prevention standpoint, what we suggest doing with the carbohydrate concentrations. And then poly MVA as a supplement. The recommendation for supplements in this course is going to be based on the assessment that you take for your pet. So there's not going to be general protocols that are recommended, because there's a lot of my colleagues that do an amazing job of that already. So this course specifically is about assessing the specific needs for your pet through diagnostics that I'm going to tell you about, through a questionnaire that you're going to get, and determining what their specific needs are. And then based on what that scorecard tells you, then I'm going to make specific recommendations about those things. Do you know when the pet parent class will commence and what the cost or range approximately would be, and what is in the content I'm just wanting to plan? I don't know that I understand your question, Amanda. Do you mean the course that is starting on Monday, or do you mean something different? Or was I maybe unclear in what I was saying? So go ahead and respond to me about that in case I am missing something. Virginia's doable. Great. Please let me know who they are on the website. And that is fabulous. Thanks. Jess, can you do me a favor and pull up Dr. Myers and Dr. Irwin's practice information and just pop it in the chat for
Oh,
me?
sure. Yep.
And then Steph said, thank you. Will the 2 live calls be recorded so we can access it too? Yeah, absolutely. So anybody who can't make the live calls live, they will be recorded. You also are going to be given like a portal to submit your questions ahead of time. So even if you can't attend the live call, your questions will be answered there. So yeah, for sure. Even if you're not live with us, your questions will be addressed and you'll be able to go back and watch it. Then the question, the group after the course, the pet parent group. Yeah. Okay. Thanks, Amanda. So, and then let me go back to your question. Do you know when it will start and what the cost or range approximately will be, and what is the content wanting to plan? Okay. So part of taking the course is a prerequisite to join a VIP pet parent group. And the reason that it's a prerequisite is because we want everybody in that group to be on the same page in that community. so that the foundation and the groundwork has kind of been laid for all of the pet owners that are coming. So that way we are a community all on the same kind of starting level, because as you know, there are some pet parents that have been on this journey for a long time and have learned a lot, and others that are brand new. So the course is to kind of get everybody on the same page. And then the VIP pet parent group, what the goal of that is to take individual cases. So although I'm not allowed to become anybody's doctor virtually, I am allowed to make recommendations off of general situations. So if you come to me and you say, I'm already following this protocol, I've already done these diagnostic tests, these are the results that I'm seeing, what would be a suggestion to do in something like this? So I can make a general recommendation. So it's able to get more individualized support about things that you have going on with your pets than you can otherwise. So it's to be like the next level of follow-up and support and community after the course is completed, for you to be instituting all those changes and then down the road coming back and being like, hey, Kendra, I've done all these things. I'm getting stuck here. What do we think could be going on? And us kind of working together on what we think could be happening, because our pets' bodies are complex systems just like ours, and they don't always follow the rules. So there might be a suggestion in the course about what to do when you get started, and it may help move the needle a little, but it might not get it to where we want to be. So that individualized support is to help us just keep diving deeper as we go along afterwards. As far as when it'll commence, it will probably commence. So let's see, the course is going to end at the end of July. So it'll probably be in the fall. And then it'll just be monthly. There'll be promotions for, like, if you pay in advance, and all the details of the specifics of that we will get to everybody by the end of the course. Okay. Is the course geared more towards pets that already have cancer prevention, or both? So the course is geared towards cancer prevention. However, the caveat to that is the way we have to think about how cancer forms. So there's very long periods of time where cancer is developing, where it goes from one cell until cancer is detectable. And during that time, there's cancer cells in our body. All of us right now have cancer cells in our body, but our body is controlling them. So even though this is a cancer prevention course, you can kind of think about it like a early cancer treatment, because it's basically ensuring that your body is functioning optimally so that those cancer cells that are already in our body are being controlled indefinitely. That's the goal, that they're indefinitely controlled. And so this can be used for owners of animals with cancer, because the approach to cancer prevention and cancer treatment is very similar. It's just cancer treatment is much more intensive, higher doses, more aggressive, faster. Whereas cancer prevention is lower doses, more gentle over time. But determining, you guys have probably heard by now, because there's been, I've said this a lot on my social media, we're thinking about the weed, which is the cancer, and the soil, which is the garden. We're in the garden evaluating the health of the soil. And so in a cancer patient, we know it's unhealthy. We know it's imbalanced. That's why the weed grew. But in cancer prevention, we're checking to see if it's unhealthy, and we're checking to see if it's unbalanced, and we're trying to catch those earlier to correct them. So it is a cancer prevention course, but it can be used for animals with cancer to help you to dive deeper to the root cause, because most pet parents can't access a veterinarian who's going to do that for them. They're going to focus on the weed, because that's our conventional system, disease-focused medicine. So both owners of cancer patients and owners of animals that want to prevent cancer can benefit. The caveat to that is if you have a cancer patient who's very sick, like let's say, for example, it's a hospice case, or you've been told the prognosis is less than 6 months, that's not a great use of your resources. I would rather you get assistance from people who can kind of help you manage that, because we need time to get to the root cause of things, and that's usually over 6 months. Okay. Okay. Got that. The VIP parent group, Jenna, is just going to be limited to people who've taken the course. It'll be like an alumni benefit. I'm enrolled in this one starting next week. Have 4 dogs. Hooray. Yes, exactly. For all of them. Thanks very much. Perfect. You're welcome. All right, great. What else, guys, can I answer for you?
Dr. Pope, is Dr. Sukaris, who used to be Blue Sage,
Yeah.
is she somebody great to have on board as a regular vet? I know you know her.
Yeah, yeah. Dr. Alicia, for sure, she has a lot of tools in her toolbox. She's a really highly trained herbalist, so she can offer a lot of support. I think it's great to have other people locally so that you have options. Yeah, I think that she's great to have, for sure. And we collaborate together, so I don't think that anything like I would suggest to you she would think is, unusual or abnormal or would be difficult, and she can support you in a lot of those. So yeah, definitely. Cool. Well, that's exciting. I'm happy to see you guys are signing up and you're getting excited about it. I'm looking forward to it. It's going to be fun. I hope everybody learns a lot. Jess is putting in the 2 doctors in Virginia for you.
So I have Dr. Myers. I'm sorry. Who was the second one?
Dr. Irwin's the other one in Virginia.
Irwin. Okay. Want to make sure I do them right. Okay.
Yeah.
Hers is coming.
And then another question, will there be another course for vets to take from you in the future? Dr. Laura was, oh, really? She might be interested in something like that, so I can let her know. Yeah, you totally can. We actually have a couple of veterinarians who are taking the cancer prevention course. There's actually 3 of them signed up right now. And so I think that they, it depends on how deep of a dive they want to take into this process. Like if it's something that they want to have be a mainstay of their practice and to help patients, or if they're just interested in learning more. So yeah, the course that's focused towards pet parents, veterinarians are allowed to enroll in. And then if they want to take like a really deep dive and make this like a huge part of their practice of what they offer clients, then they can take the higher level mastermind too. Thank you so much for the course. I know what you taught me with Bear, Kid, and Tifa. Well, that must be Deb's iPhone. Thanks, Deb. Great. I will let her know. Awesome. Thanks, Amanda. That's great. Yeah, cool. Yeah, Dr. Laura provided some information for the vets already in the program too, like her nutrition approach. I had contacted her for some things, so there's some stuff in the course for her. Awesome. What else would you guys like to know about it? She's just fabulous and advised and take the course next week. Awesome. Great. She loves you too. Awesome. So the course will start on Monday. For those that you have signed up, amazing. Can't wait. For those of you who haven't, we won't have it again available till next year, a whole nother year. What else about it to share? Let's see. What are things that we haven't talked about yet and isn't online? Yeah, we're just putting in the vet right now. Perfect. Let's see what else. I think one thing that's come up a bit in some of my podcasts and other social engagements that I've done and some questions that have come up is kind of why do cancer prevention now? Why think about it now? Because sometimes, it can be difficult to think like, why should I invest my time and my money into something that I don't know if it'll ever happen? Or, I have a young animal, it's so long down the road. Why should I think about it now? And that brings up the point about, that's the long-term goal of the course, is to prevent cancer completely, to delay it from happening, to minimize the aggressiveness, make it less aggressive if it does happen in the future. But the short-term things that happen in executing this cancer prevention lifestyle are noticeable changes and noticeable benefits that you'll get immediately. So what some of those are include being able to get really specific and tailored about what type of diet and what type of supplements is needed for your pet. It can be really overwhelming to try to use all the information and cut through all of the marketing of all of these companies to really know what is needed for your specific pet. And that's going to require some tailored and individualized information, which is why the course is beneficial. You know, what are their weaknesses? What is their history? What, you know, do some of these diagnostics, if we run them, show us to help us to tailor that. So that's going to help us to get really clear about diet and supplement plans. So that's something that's an immediate benefit. The other thing that's an immediate benefit is kind of what we alluded to earlier, is that in preventing chronic diseases like cancer, you are, in your prevention, you're doing mini treatment to what's already happening. And because cancer, the weed of cancer, is not going to grow in healthy soil, all other diseases are driven by the same unhealthy soil. So if your pet has some allergies that have been going on, some ear stuff that's been happening, some chronic GI issues that have been going on, all the things we do to prevent cancer and to live this cancer prevention lifestyle are going to help to correct those other conditions also. So there will be immediate improvements in other systems, because all the things we do to correct and prevent cancer are going to help to make that soil healthy, which is the same thing that affects all other body systems. So there are immediate things that we're going to see with the long-term bonus of it being addressing cancer and chronic diseases. So I wanted to point that out too, because you know, obviously the course is directed to prevention of cancer, which is the long-term goal, but there are going to be some immediate short-term goals. Got some questions coming in while I was talking. Will we need a doctor to go over diagnostics we get during the course, or will we learn how to understand the results in the course? So if you elect to do some of the diagnostics that are made accessible to you through the course, they will be provided to you directly from the companies. So they will be sold direct to you guys as part of this course. If you do them and you get the results, although I'm not allowed to become your pet's doctor and make medical advice, what I'm going to do in the course is I'm going to go through these tests with you and say, these are the results, this is what these mean, this is what you would do if this is happening. So it's going to be more about educating you on what these tests are looking for and what to do with certain results of the tests. Michelle wants to know how much the course is. Jess, if you could pop in the sales page so she could see the 2 payment options. And then Michelle said, I've received messages about the free video you have on cancer. Would this be helpful to watch before class starts? Yes. Michelle, do you mean the webinar? Do you remember if it was the webinar or if it was the Why Cancer Prevention video? There was one that was about a half an hour long and one that was about 4 minutes long. You can watch both of them for sure. The information in those free videos will be covered more in depth in the course. Everything in the free videos, you will get more information in the course, so they're not a prerequisite. You don't have to watch it before Monday. My dogs all used to get oncocanine tests yearly, but it closed down. Do you recommend the newer Oncotech course that can detect 4 common cancers in urine? I did that one a week ago for my 4 dogs, so just awaiting results. The studies so far are promising, but still in infancy, obviously. Yeah, so the test that you were talking about was a blood test that used to be as close to what they have in people to do blood biopsies, and is no longer available. That company lost funding. So yes, there's newer companies coming out all the time, and there's one on urine. We spoke with him maybe about a month ago, and it's an interesting test. So yes, I do recommend them as part of our screening and our diagnostics, and it's going to be on the list of diagnostics to consider doing. but they all are data points that you're going to take into consideration with one another, because there is no one test that is going to give us all the information we need. Because again, we have to remember we're on this continuum where we go from one cell to many cells to a billion cells, and there's always a threshold. So even in the blood tests, the urine tests, there's a threshold of cells that it has to go past for it to be positive. But there still could be things going on under that threshold that are abnormal that we're going to want to detect and correct in the beginning. Will supplements you recommend require a prescription? So the majority of the supplements that are recommended whenever possible are going to be over the counter, because there are a lot that are available over the counter, and I want you guys to be able to access them. If there are treatments that require a veterinarian to get involved, let's say, like I think acupuncture for this condition or this thing that's wrong, or I think more advanced treatments or prescription strength supplements, then I'll make suggestions of that. But the course is really to empower you to do as much by yourself as you can in a really strategic, individualized way for your pet. So there will be those advanced techniques that I offer you that may suggest you get a veterinarian involved. Or let's say that you do the basic and the kind of techniques that you're able to as a pet owner, and it's not moving the needle not enough or not making a difference enough, then that will be when I would suggest you get a veterinarian involved. So to answer the question in short, the majority of the recommendations are going to be made available so that you can do it yourself. Do you recommend VDI labs for some of your testing? Yes. So they're going to make these diagnostics available to you guys directly without a veterinarian so that you can purchase them straight through them. The thing about the VDI lab tests is that almost all of them need blood. So you are going to need the help of a veterinarian or a veterinary technician to get that blood sample for you. So you'll still need to have a collaborative relationship with a veterinarian so that you can run those tests. Can we ask about a certain supplement in your opinion? For instance, my dogs take Nutramax immune pills, used to be Cell Advance, recommended by Dr. Laura Nordic Naturals fish oil and Real Defenders mushroom. So in the live Q&A, we can get more specific about examples and things like that so that I'll be able to reference the material, because some of my suggestions about what to do are going to help you to answer some of those questions. So for example, like you made a comment about the mushrooms. So I will make the recommendation about what type of mushrooms I think are best, and then you'll be able to look at your product that you're using and be like, oh, good, this is, what she likes. And so you'll know to use it. So we will be able to dive into those kind of specific questions during the live calls. Great, thanks. You're welcome. Awesome. What else? Will you discuss glyphosate and the test for that? We use Natura Lawn and Wondercide, so doubt there's any glyphosate, but that scares me. I have to use Heartgard 2 and Bravecto topical. I only use one tube for all 4 dogs every 3 months, and it still works. But being in South Carolina, it's hard not to use those things. So I will definitely discuss glyphosate, which is the active ingredient in Roundup, and I will definitely discuss how we're going to test for that. I'll also, whenever possible, make accessible to you how to test how to access the human tests and how to access the home tests. So checking for glyphosate in your own urine and your pet's urine is important, but it's also really important to check in your water. So most people think that Roundup glyphosate is going to come from exposure to the pesticides on lawn, which it can, but actually we found that the primary source of Roundup exposure for animals is actually in their food, because so much of the ingredients in commercial pet food is sprayed with Roundup. So I actually recommend, even if patients have, they live in concrete in the city and they've never touched grass, that they be tested for Roundup. So yeah, Yes, food, it's terrifying, and the water. So there's water tests for glyphosate too, because what happens is even if you're not spraying for glyphosate, the half-life, which is the amount of time it takes for half of the chemical to break down, is 155 years. So this stuff stays in our environment for really long periods of time. So it's definitely leaching into our water systems. Okay, even from fridge water that is filtered. Yes, because unless you're using a reverse osmosis system, you're likely not filtering it everything. So that's something too that I'm going to talk about in the course is like, how do you check your water? How do you assess what, carcinogens could be in your water? What kind of filters should you be using? How to test your, the water in your area? Because the refrigerator filters are usually just carbon filters, which means that they're not getting pharmaceuticals out, they're not getting hormones out, they're not getting heavy metals out. There's a lot of things that they're not filtering, unfortunately. Trooper and Christine, do you find some pet insurances are better than others at covering these diagnostic tests and holistic treatments? Mine, Healthy Paws, doesn't, and the expenses are really adding up. Yeah. So we do have some clients who have insurance who they cover everything. Definitely the diagnostics, the things that we consistently run into not being covered are ozone therapy and mistletoe because they're not FDA approved. But the supplements, the diagnostics, we have had clients who have had a lot of success. And I think the one that's been most helpful for them is Trupanion. I'm surprised that Healthy Paws isn't. I thought that was one that was pretty good for people, but it's also possible, Christine, that they're starting to get wind of these and they're starting to take them away because, as you probably know for yourself, these are all out-of-pocket expenses on the human side. Human insurance doesn't cover any of them. Will the course cover natural prevention for heartworm? I stopped giving my dogs heartworm prevention as I heard it can also cause cancer. Yeah, so the course is going to cover flea tick heartworm medications and the risks associated with using them. So as part of the prevention strategy that you create after you do your assessment, there's going to be suggestions of what to do if you want to avoid those. So like Amanda was saying, she's in South Carolina. That can be a really challenging place in the United States to avoid completely. You might need to use some, but yes, there'll be suggestions on kind of the basic and advanced ways that you can avoid using them and the other things that you can consider. Yes, yeah, Amanda just said Trupanion covers ozone and mistletoe too. Wow. All right. Perfect. We love that. Great to see you too. Can you share your thoughts on how this course will benefit pet parents like me who have had the privilege of working closely with you on actual cancer treatments already? That's a nice question. Thank you for asking. Nice to see you.
Nice to see you, Dr. Pope.
So, I just thought of you the other day because I got the Vosges chocolates for
Oh,
someone.
you did?
As a gift, and they like
Oh.
thought it was the best thing ever. And I was like, I learned about this company from this amazing client I had who gave
Oh,
me
thank
that,
you.
like opened my eyes to this company. So yeah, so thank you for that question. So and that is something I forgot to address. The course is 8 weeks of material that each week is like between 1 and 3 hours. And even if I'm working with clients for many years, I don't think that I ever get that much time to talk with you about all of the things that I've learned because
Right.
we are talking about, your pet that we're working with. So I think the big benefit of this course for my clients who I've already worked with is more education opportunity, because I want you to know everything that I know so that you have that information moving forward. So I would say that that's probably one of the first benefits. The other one is access to this scorecard for you to always use, because then you can use this as kind of a baseline for your pets. Like, okay, let me check what's going on with them. what is their score right now? Then that's where you can get us involved, as your veterinarian again, and say like, this part of, my pet's score is really bad and everything I've done, it's not shifting the needle at all. What more do we need to do? So I think
Okay.
it gives me the opportunity to share more information with you than I've been able to in the past. And then also just like empower you guys a little bit more for when we work together. I mean, from our conversations, I've always really appreciated clients like you that come with so much information already, because it makes my job easy, right? Then we just like dive in, we're on the same page, we have
Right.
the same philosophy. And I want to do that for as many pet parents as possible. Like, let's give you the information so that you understand why we're doing this, and that you can be your pet's advocate and make sure
Mhm.
that that's why we're following this. Because as most pet parents know, most veterinarians are unaware of a lot of this information. So you get pushback from
Very
them.
true.
So if you have all the sources and you have all the information coming from someone that, they should be able to trust, it makes that part a little bit easier. So I think that that's probably what I would say the biggest one is.
Okay.
Yeah, thank you for
Very
asking that.
good. Very good. Thank you so much, Dr. Pope. I can share with everyone on the call really quick. Dr. Pope and I worked together for a long time with my beloved boxer who had stage 4 lymphoma. And he wasn't given very long to live, and he lived another 11 months, which is unheard of. And it's because of all the work that we did with Dr. Pope and everything that we learned. And we now apply that to our other boxers and our new puppies. So just wanted to share that with everybody.
Sweet, thank you. Yeah, and all of the work that you did, right? I was just there to kind of guide you, and you were the one having to do all the hard stuff. So, yeah.
Well, thank you so much, Dr. Pope.
You're welcome. Thank you. Mid asked, will you be discussing vaccines too? Titers, but South Carolina does not recognize titers. Yeah, I'm going to talk about vaccines. I'm going to talk about the risk factors of vaccines, what's good about them, what's bad about them. It's really, it's not going to be, the course is definitely not going to be, this is what you should do. The course is going to be, this is the pro, this is the con, this is the assessment of your animal. And then we take all that information together to decide what the most appropriate thing for them is. Because for some animals, doing a vaccine is appropriate. For other animals, it's not going to be at all. So that's where getting into the specifics and nitty gritty of the needs for your pet is going to be really helpful. But yes, we'll talk about for people who maybe don't even realize that you can do vaccine titers and what are the pros and cons of them and why would you want to. So we definitely will talk about that. Nom stop making cat food. Are there other company recommendations? Yeah, I'm going to give you access to where I look for the companies that I think are the best. Someone who vets all the companies every year that I believe that you can trust, and how to find them. But yes, we've learned of some new cat food companies too, so that we can share those with you. No worries. It's good. It's good you're asking questions. I'm sure if you have it, other people do. So it's awesome. It's great, because then we can let everybody know all the info. So no worries at all. Let's see, what have I missed? We talked about immediate benefits, because there's definitely some of those. I think the other thing that's come up in a couple of conversations I've had with podcasts and things recently is, for me, part of what prompted me to do this and part of my mission in educating pet parents is to also tie it back to the effect on us as their owners and just the impact of cancer on us too. And something that happened pretty early in my career, and Deb, if you're still on, you may have been one of the early people that kind of sparked my brain about this. I realized that in you as a pet parent caring for your, four-legged family members, that you yourself would start having shifts. My clients would come back and they would be like, man, everything you taught me about diet for my pet, I've been thinking about for me. Or, when we really changed from this to that, I saw such a big difference in them. And so now I'm doing it for myself. And I noticed this really cool impact that it could make for my clients' lives, not just my patients' lives. And any of you who know my personal story, you know that the reason that I'm in the cancer space is because of my loss of my father at a young age, and really wanting the impact to be not just in the four-legged, patients, but the two-legged patients too. And so what I have been getting really excited about and putting the content together for the course is that so much of what I'm sharing with you guys is based in the data that we have from people, because we have so much more data in humans than we do in animals. And so, like, just passively, you're going to get all of this information about how to protect yourself and your two-legged family members. And with cancer being such a rampant disease that the rates are just increasing so wildly, this is something that we all have to be thinking about, and we all have to be protecting everybody in our family about. So I just feel really lucky to get to share this information with you, for you too, and your family, because I think that, like, the greatest gift that I got in going down this journey and learning about these therapies for my patients and my own pet was that there was all this just like passive knowledge for myself to make myself healthier, and to do the tests for me, and to be like, oh shit, my glyphosate level is really high. How did that happen? And you go down this journey of identifying these things under the surface that you didn't even realize were there. So, so I hope that it really does that for you guys too, because the data is so similar. They live in our environments, they get cancer rates similar to us. There's a lot of things that are very much the same. So I hope that it also helps to empower you guys and make you healthier too. Yeah, Deb said it's true. Yeah, I thought you were one of those ones in the beginning. Okay, so will you be covering specific cancers and suggested protocols and preventions for them? So I'm not going to be covering specific cancers in the sense of lymphoma, hemangioma, osteo, because if you've heard how I talk, and you'll learn in the course, you could have 3 patients with lymphoma. Each one of their cancers are completely different. They're specific to them. And the things that cause their cancers are driven all by different things. So that's why you want to treat the patient, not the disease. You want to identify the soil problems, not the weed, because that's what conventional treatment does. It says, this is lymphoma, this is the protocol. But, this lymphoma is different than this. And your holistic and integrative approaches are different because they're caused by different things. So you're not going to be getting protocols for cancer. You're going to be getting information about how cancer happens, so that you can use that to understand what's driving cancer and the baby cells that could become cancer that we're trying to prevent. And then you're going to deeply understand how to evaluate the soil, so that we can keep the soil as healthy as possible. Because keeping the garden really healthy is going to prevent weeds of all kinds. And so that's going to be our goal. So we're not going to be talking about the treatment of the weeds. We're going to be talking about the soil health. So if one wanted to work with you directly in the future, is that possible, or do you do distance consults? Obviously, New Jersey is far from South Carolina, or is the purpose for the vets taking your course to, yeah. So I currently am not taking new patients in my practice, because my focus is shifting to education and getting the message out to more people like you, and like having amazing people in Singapore that I can interact with, which is awesome. Dr. Marino at my practice is taking new clients. So we are still taking new clients at our practice, and that's welcomed at any time. But yes, part of me training veterinarians is that so that our reach can be much wider, because obviously our tiny practice in just one place cannot help enough patients. So yes, so every year we're getting new veterinarians with the next group starting in the fall. So we'll have more. Jane, our goal is to get vets in other countries too. We have 2 in Canada right now, but we're trying to get vets in other countries as well. Okay. Very excited to go through the class, but a little worried. Every one of my Goldens has died from cancer. Though my last boy had osteo, lived for an amazing 3 years. That is amazing as a result of holistic modalities. Yeah, awesome. Yeah. I actually was just recording the course about that yesterday. And although cancer, we strongly believe and have evidence that 90 to 95% of cancers are caused by environmental factors. We know that dogs and dog breeds specifically have really only come into existence in the last like 300 to 400 years. Before that, all the dogs were like wolf, descendants. And so in a very short period of time, we've created all these different breeds. And what that's done is something called it's called lack of genetic diversity. And so basically, instead of us having these wide gene pools with all these different genes, like what's happened to humans with like, us having offspring with lots of different people, we've had these really narrow gene pools. And so in that lack of genetic diversity, there are things that happen, like increased cancer rates. Now, that doesn't mean that it's a genetic disease. It still means that it's affected by environmental factors, but it means that we probably have a little bit more work to do in some of these breeds than if we were dealing with like a mixed breed dog or like a wolf descendant that had a wider gene pool. So I do think that it means we're up against a little bit more with our purebred dogs, but there's still evidence to show that what drives cancer in the narrow gene pools are caused by things in the environment that we can work on. So I still think it's worthwhile because as you saw, even in the osteo, your last boy having osteo, that it was helpful. So I think that that shows it would be helpful in the prevention state too. For years, I've done research and been armed with info that I always bring to the vets. As you said, most vets are not informed and they do sometimes push back. Yes, but you're a blessing. Oh, that's very nice. I really appreciate your heart and wanting to share your experience in teaching and supporting us. That's really sweet. Yeah, I know that there's already a shift happening. Probably most of you informed pet parents already realize that there is a movement happening in educated pet parents, and the veterinarians are recognizing it. Also, the big companies are recognizing it, which is why they're investing in some of these fresh food companies. And so it doesn't matter that we convince all of the veterinarians. It just matters that I inform you guys and educate you and empower you to have this information, because you're going to find somebody who you'll be aligned with. You will be able to do that. And even if you can't, you'll be empowered enough to do a lot of it on your own. Because it's going to happen. Like it just, there's so much momentum now that it can't be turned around. I know there are also oncologists for pets with cancer in each state. Yep. But there are conventional ones you specifically know and work with. I know Dr. Sue, a lot more knowledgeable, things outside the box, willing to work with a holistic vet. Can those vets trained in your program also carry out the complex protocols? Yeah. So the whole goal of the training program for the veterinarians is that they don't need to be oncologists. They will function as an integrative oncologist without the conventional background. And then we will give them access to oncologists to consult with if they need to for the medical oncology portion of it. But I anticipate some oncologists taking the course because they've already expressed interest. So I think eventually we'll have both. But yes, the veterinarians taking the program will be able to function as integrative oncologists without doing the chemo part, and will absolutely be able to do vitamin C, mistletoe, all that kind of stuff. So yeah, for sure. Awesome. That hour flew by, guys. Lots of great questions. Do we have any final things about the course? This weekend, I know that we will be posting the Q&A, so the video from this one and the last one. If anybody hasn't had a chance to watch the webinar, just can you also pop the webinar link into the chat? Anybody who hasn't had a chance to watch the webinar, feel free to watch the webinar. We also just did a little why cancer prevention video that's on our social page. Again, if you have not purchased the course yet, keep an eye out this weekend, because if we do end up doing any different payment plans, we'll be announcing that this weekend on social. So Facebook or Instagram, both of them will have all the information, so you can keep your eyes there. And then I'm trying to think if there's anything else to get you guys up to date on everything. I think those are the main ones. Yeah, those are the main things. So there's an email address on the link pages if you have other questions about the course that we'll get back to you about. And then it's gonna close on Sunday and not be available again until next year. So I would totally love you guys to get started with us now. It would be amazing. I watched it twice. It's great. Thank you. I appreciate that. Thank you so much for this meeting. You're so welcome. Yeah, I hope you guys have a wonderful weekend. We're really looking forward to starting next week. I think it's going to be a lot of fun. So excited to see everybody there. And yeah, we want to get this information to as many pet parents as possible. So any other questions you have, email us at that hello at email, and we'll get back to you. And yeah, I hope to see you guys there. I would love for you to join. So come and
Pope,
have fun.
oh, I'm sorry.
You're good,
Dr.
Michelle.
Pope,
Go ahead.
I just wanted to ask you two quick things before we go.
Go
How,
ahead.
I'm not technically savvy, but how do I go back and listen to this or the recordings? How do you do that?
Oh, in the for the content when it goes live?
Mm-hmm.
Yeah,
Yes.
it'll be so easy. So part of the first week, we're going to show you how to get familiar with the membership site. And what you're literally going to do is it's all going to be on one web page. It's going to log in because you have to have your password to get in. And when you log in, you're going to click on the lecture you want to listen to, and there's going to be a video right there, and you'll just push play. And then it'll be there indefinitely. So at any time you can go back and watch it. So it'll be really intuitive and easy. And we'll walk you through it also that first week if you have any questions about it.
Okay, and my last thing before we close,
Yeah.
here in New Jersey, I'm down in Tom's River. Other than say Dr. Blue Sage, you said in the course will be recommended vets that would be on board, uh, that would take cats as a client. Like if
Yeah.
say she wasn't available, there'll be other because I don't know of anybody in New Jersey. So
Yeah. And obviously, since you're so close to us, Dr. Marino, my associate at the practice, can be of a huge help because we work directly together and share all of our patients. So we can help at any time. But then for people who are further away that maybe don't have access to someone, we can we're going to give them that information so they can hopefully find somebody. But I'm going to do as much as I can to give you guys everything to be able to take it as far as you can before you need someone.
thank you.
Yeah, of course. You're so welcome. Cool. So Jane, did you find anybody on there that is in Singapore? No. Shit. Okay. I wonder if any of my colleagues in Australia consult. Because you would basically obviously want to tell somebody to do telemedicine to assist with an integrative approach, right?
Yes,
Yeah.
because actually right now, he is on an integrative approach, but
Okay.
I mean, thankfully I have a TCM doctor who
Great.
is
Okay.
willing,
Okay,
but
good.
he's not vet trained. He's not a vet.
Got it.
He's a
We need the
human
veterinarian.
TCM doctor, right? But he has the guts to look at the ultrasounds, the blood work, and from a human perspective, extrapolate to to
Yeah,
my
which
kitty.
is really
And I've
helpful.
seen, and I've seen results in terms of other aspects of his gut, in terms
Yeah.
of like gallbladder sludge,
Yeah.
the liver chi, and etc. But I think the big question mark here is still lymphoma. The moment I take away vincristine, what is going to happen? I think
Yeah.
that's my main concern. Um, so I mean that's where I am at. Yeah. So
Would any of the veterinarians you're currently working with be willing to do a like doctor to doctor consult with our practice?
yes, I think. Well, yes, I
Okay.
believe. Well,
That
I
might
have.
be the easiest way for us to help you because we can do doctor to doctor consults, telemedicine. So if your veterinarian is willing to do that, then we could schedule a consult with them. And so basically what would happen is our Dr. Marino is facilitating them right now. She would review all the medical records, then make the recommendations to the doctor of what could be done, and then they could execute it. And then what we could do is just make sure that it's like noted, you have a TCM doctor, so that that part can be handled by them. Do you have any oncologists in Singapore? Like the conventional ones?
Well, the vet that I go to currently for the vincristine treatment, he has not kind of he's not used the term oncologist on himself, so I don't think he is one. He's
Mhm.
not a cancer specialist, but he's used this protocol, the low dose vincristine,
Yeah,
for 40 years for
yeah,
lymphoma patients, and it has worked. So, I mean, based on his knowledge and that experience,
yeah,
he's coming from that. But to be honest, I've not looked into whether there are any
yeah,
oncologists here that can help.
yeah.
Yeah. You're gonna get the special, yeah, well, that would be the specialist hospital, which is, yeah, short answer is no. I'm not looked into it. Yeah,
Okay,
yeah.
so then maybe what I would suggest is ask your veterinarian if they would be open to us doing, a review and making suggestions. And if they want us to make the chemotherapy recommendation, then we'll just have to figure out how to facilitate that, whether I would do it or whether I would get my conventional colleague involved to like put something in writing for you, if they would be open to that. Like if they're open to hearing an oncologist's opinion and say this would be suggested over what you're doing. But sometimes, veterinarians get offended by that. So I'll let
I
you
know.
decide if you think they're the right person for that or not.
Yeah, I know
Yeah.
what you mean.
Yeah.
I mean, the vet that has prescribed this protocol, he's probably going to run into that problem that you mentioned. However, I have a GP
Perfect.
vet who will
Yeah.
be very open, I
Great.
think, to sit with you or Dr. Marino,
Great.
yeah, to
Perfect.
run through. But yeah, yeah. So I just feel that I'm like cobbling things
Yes.
together here in
Yeah.
Singapore.
Yeah.
It's a challenge. Yeah,
Yeah.
yeah. But yes, if I can get in touch with um your doctor associate,
Yeah,
your
so what
colleague
I
in.
would do is I'm trying to think about the most streamlined way for us to do this. There is a form on our website for when veterinarians want to consult with us that they can fill out. So what I would say is I'm going to give you, I'm going to put in the chat our main email address for the practice. Actually, I'm going to give you the new client email address. And what I would say is just have the conversation with your GP and
Okay.
make sure that they are okay with this. And then once they are, you can either ask them to go directly to the website and fill it out, or if they want to speak to us first, you can use that email address and we'll send the form that needs to be filled out. Basically, it's just like they have to consent that they want to speak with us, and then we schedule it, and then we go from there.
Right. Okay. So it would just, I mean, how would the whole process go after kind of
So
getting
they
consented?
schedule a time for the doctors to talk, they speak, and then whatever is needed next, they decide upon. So like if your vet wants to go back and do those treatments and then recheck with us, we set up rechecks. If they just want to take the information and talk with you and then institute their own plan and kind of go forward with it, they can do that. So we can be just involved in the beginning to make a suggestion, or we can be involved in ongoing rechecks if that's what you guys want done.
Okay,
Yeah.
great. Okay.
Yeah.
But thank you so much. This is
You're welcome. I hope
it's
that it
it's a
yeah.
hopeful, it's really like hope that open up. Yeah,
Oh,
so
good. I'm glad
thank
to
you
hear
so
that.
much.
Yeah,
Yeah,
I
yeah.
hope that we're able. I know it can be really frustrating in certain parts of the country, the world, to find people to access. So, thank you for being interested and trying to help your veterinarians to know more so that they can do more.
Thank you. Thank
Yeah,
you so much, Dr. Pope. Thank you.
you're welcome. Thank you for staying up late with me. Awesome. Is everybody else good? Anybody else need everything? All right, perfect. I'm gonna stop the recording